Hey there, good morning. You're up early with us. Thank you for that. But insomnia is on the rise, with up to 50% of Americans saying they're having trouble getting to sleep, and many of those sufferers turning to sleeping pills to get a full night's rest. But what are the dangers of those types of medications, and could you be putting yourself at risk? Joining us now is emergency room practitioner Erin Tolbert. Good morning to you. Thanks for being with us.
Good morning, Anna. Thanks for having me.
So what's the reason behind this? Is it because we can't turn off the TV, or we can't stop playing with our phone, or what?
Right. I think a lot of us go to bed. We have our significant other on one side, then we've got our phone on the other, and so you're trying to go to sleep, your phone's vibrating, you're getting emails. Makes it hard to leave work at work and actually get to sleep when you need to. We're also not as active. We need to get moving. A lot of us have tired minds, but we don't have tired bodies when we get to bed. And so we're just not preparing ourselves well for sleep at night.
Right, so a lot of people are turning to sleeping pills, and there are some side effects, though, that aren't good. We'll talk about that: sleepwalking, and sleep driving even. Wow. Morning after drowsiness and long-term health consequences as well. What are some of those long-term health consequences?
Well, a lot of times sleeping pills can cover up a baseline issue with your sleep. There are a lot of medical conditions that can cause you to sleep poorly. For example, if you have an overactive thyroid, it can prevent you from getting good sleep. If you have a condition called sleep apnea, that actually causes pauses in your breathing during sleep. These kind of medical conditions are dangerous. They can lead to strokes, high blood pressure. So you need to get to the baseline issue of why you're not sleeping well. For some people, it's just poor habits. For other people, it might be a medical problem.
Okay, so you want to go to the doctor, but maybe you should try some of these things first, like regulating your body clock, some cognitive behavioral therapy, and avoiding long-term medication use. For people, though, who are overnight nurses, like you have to do sometimes, or me, I wake up in the middle of the night for this show, people who work in diners, truck drivers, what do they do if they can't regulate their body clock?
Well, I think getting some good sleeping habits in place. Sleep in a cool, dark room. If you can get some blackout curtains, that will really help. Also, just preparing your body. Get a nighttime routine. And if you sleep odd hours, just get some sort of habit that you do before bed. Maybe you read a book, turn off the lights, and then fall asleep. Maybe you take a shower and then get in bed.
Okay.
Just have a good habit that you can get into.
It's nice to have these healthy alternatives, but the problem is, you know, it's a lot easier to just pop a pill than to try to do all this. What are some of the other issues with sleeping pills?
Like you talked about, the side effects. A lot of times people don't realize what they're doing when they're on these pills. They might drive and not realize that the blood concentrations can remain elevated into the morning, and so you drive when you're still drowsy or under the effects of these medicines. Some people are on multiple medications. Antidepressants and pain pills are also sedating, and these are very commonly prescribed medications. So if you take sleeping pills on top of your other medicines, you actually get a combined effect where you might get too drowsy or over sedated, and it really leads to an overdose situation. I see this a lot in my practice.
And what about getting addicted to these pills and not being able to fall asleep without them?
Exactly. If you take them too long, you rely on them. It begins to become a habit, and so it's much harder to get off of them. I say use them sparingly and temporarily. If you need them to get over some jet lag, if you need them to switch from the night shift to the day shift every once in a while, it could be okay. But don't take them every night. Talk to your doctor about other options. You could also see a therapist. There are special sleep therapists that can help you keep a sleep diary and evaluate why you're not sleeping well.
So there are some alternatives out there.
There certainly are.
Erin, thanks for your time today.
Thanks, Anna.